This webinar is a portion of the Wisconsin Pharmacy Quality Collaborative 2018 annual meeting presentation entitled Serving the Underserved, Celebrating 10 Years of Making a Difference with WPQC. Pharmacists across the state have found unique ways to incorporate the WPQC standards into their practices. This first video illustrates how a patient advocacy group, Unite MKE, empowers community health workers to connect with underserved patients in the Milwaukee area through a program entitled the Hub Model. Unite MKE serves as a hub for the Milwaukee area. Community health workers use integrated software to uncover patients' social determinants to identify and address barriers. Once a patient is identified, community health workers set up meetings at a patient's home. Following the home visit, the community health workers streamline the communication between the healthcare providers and the patient. This streamlined communication results in better health outcomes and decreased healthcare burden. HAYAT Pharmacy, located in Milwaukee, is one example of this work in action. HAYAT receives patient referrals from the community health workers to address medication adherence concerns. This video will also show pharmacists from HAYAT conducting comprehensive medication reviews for the Burmese refugee population in their homes. Please watch and see how Unite MKE and HAYAT Pharmacy utilize the WPQC standards to advance our profession.
Serves as an advocacy for the folks who are being served, the folks who are serving, and to be able to take the work that they're doing on the ground and in the homes and turn it into policy. It's overwhelming. You know, the doctor is overwhelming, the insurance companies, everything about systems is overwhelming to people that are just trying to live. So when someone shows up to your door and they look like you, their demeanor is kind of like very relaxed, I'm here to help, it makes it easier to open up and say, you know what, yep, let me just share with you all of my business and let you work that out for me. Right? So if you don't have a community health worker that's not only in the ground, but talking back and forth to the provider to say, hey, I'm in the home with your patients, and this is what I'm seeing, this is what they're experiencing, how can we help here, you at the clinic, so that this person can get what they need? And so the software allows us to work with the family, take that information, communicate it back to the provider, and then close that loophole of what needs to happen for that patient. Our pharmacists with HAYAT, one of the problems that we had identified was that folks can't get to their prescriptions in some cases. Schedule, transportation, whatever. So being able to have a pharmacist that can help mitigate those barriers as it relates to getting prescription, whether it's having it delivered, personally delivered, or mailed, or creating some type of coordination with the community health worker and the clinic so that that person can manage their medication appropriately were just great pieces to just anchor this project down for us.
What I like about WPQC is that it's giving us the opportunity to advance with our profession, to do things that we're meant to do after we finish school. So you're not just at the pharmacy checking prescriptions, making sure that this is what they're supposed to get, but you're actually helping the patient, actually making a difference in their lives, taking care of them and their loved ones. And it's up to you to use the platform if you want to actually do better with your profession.
Kind of notice and observe these patients at their home, to really realize that how important it is for you to sit down and talk to them in their home, in their comfort zone, where they're open to you, they're willing and they're listening. They're not worried about grabbing their ride when they're done at the clinic, because when you see them at the clinic, they are rushed up. If they miss their ride, they're going to be stuck in the clinic for another couple hours. Whereas when you're seeing them at their home, they're relaxed, they have their full attention, they're focusing, and you can make a more deeper impact on how they understand their medications.
the Burmese patient population, that's a very unique population, and the way I call it is always, no matter as a Burmese patient or regular patient we always try to provide a package from HAYAT. Mostly what we do is just teach them how the system works. They come from another country, they speak another language, and they have no idea. They've been living with their condition for the half of their life, and now they're being diagnosed with something. They've been living their conditions, their high sugar, their high blood pressure, their headache, as a norm. So we have to teach them what is right, what is wrong, and where to find those helps, where to find the doctor, where to get the prescription, how the system works.
It was a great way where the pharmacists could learn and get certified and be able to offer medication reviews or CMRs to the patients in Wisconsin, especially being in Milwaukee where we work primarily with a lot of Medicaid patients, and typically it's 10 to 15 medications on a patient profile. It's nearly impossible to do a consult when they're in the pharmacy. So that has opened the opportunity for community pharmacists to work more closely with their patients and yet be recognized for their time and value their time. PSW has helped connect the pharmacists across the state together and be able to learn from each other's practices, because that's the way to go, where we want to learn and we want to see how other pharmacies are working and kind of work together and grow together. So.